Public only thinks, I went there, the scheme told this is the treatment. I thought I got the right treatment. Why my disease is coming back? We take pride in talking about problems. That is the negativity of our system also. How is it possible a person who is driving a fancy car and a person who is living in a shackles, who is a rickshaw wala or a poor farmer, can they also get the same treatment? Is it possible? I am trained to do the right treatment that I couldn't deliver because the system did not allow. I have sleepless night. What is it? Ethically, morally, have I done the right thing by not giving this treatment? Should I have told her to go somewhere? What should I have done? So this is the dilemma doctor with moral values go through. So one parliamentarian asked me, Doctor, is there any definite evidence that smoking and chewing causes cancer? What can I say? Redefine the role of government, redefine the role of private enterprise. For all these issues, there is only one answer, what I call as universal healthcare. Hello everyone. Today we are going to talk about healthcare. Since I've been in healthcare, both in United States and India, managing very complicated diseases and how healthcare costs is escalating, is there a reason for the cost to go up? And globally, how we have done with the cost? And what are the ways forward for the Indian healthcare is what I would like to discuss. Because from what we know, healthcare is an important aspect. As we become affluent, as we live longer, health becomes a major issue. In the past, as we know, there was communicable diseases. People face diseases like cholera, tuberculosis, malaria, smallpox. But we have found remedies for all that. Very few people die of these diseases now. Plague, for example. Nearly 12 million people died of plague in West Bengal. But all of that is not relevant today. Today, relevancy is non-communicable diseases. Apart from, having usual old age related or age related like arthritis, you have cardiac diseases. We also have now diseases such as diabetes, cancer, Alzheimer's, which are causing a major impact on the longevity as well as cost. The question is, who is responsible for the cost? When you're born in a nation, is it the duty of the country to take care of your health needs, irrespective of the socio-economic status? Or should you fund it yourself through certain schemes like insurance, private insurance, or cash pay? So let us take a step back and see how the world looks at it. When you look at countries which are advanced, for example, most of the European countries, we have a system where the government takes care of it. We have the NHS system in England, which is not doing very good because of the cost is so high and the waiting periods are so long. It is a system which is broke. But small countries, Scandinavian countries, European countries have done fairly well based on the concept that once you're a citizen of the country, we will take care of your health. But there are no limits. If you carry a citizenship card, you are provided insurance and for all diseases that take care. Not only that, if you have certain debilitating disease, like for example, childhood diseases, genetic disorders, muscular dystrophy, the government not only takes care of it, but pays you so that you can get help. Like a friend of mine who lives in Amsterdam, her son gets nearly 5,000 euros, which is given so that they can have good care. So this is a well-established, advanced countries do that. When it comes to countries like United States, they may not have all of these systems in place where I used to practice for a long time. There is also a system where you can take private insurance or your employees can pay for you, or as you age, the government takes care of it through a system called Medicaid. What does a Medicaid system mean? It means when you are young, you are compulsorily have to pay, because out of your earning, a certain percentage is taken out as a healthcare cess. So you pay into it like you pay into your social security. As you age, when you reach 62, 65 years of age, the Medicare kicks in and unlimited amount that will cover for you. I myself, even though I am now not a US citizen, I gave up my green card, everything. Because I paid into the system, I have a Medicare card which I can use it any hospital in the United States and get free care. So the Medicare card takes care of it. People who are indigent, who are not paid into the system but who are citizens of the country, they also get benefit through a Medicaid, which the state and central government funds it. So it is a system which is fairly okay. There is no long waiting period. You can go to any hospital and get care, even though the cost is high. Why do I say cost is high? Because in the United States, it is 18 to 19% of the GDP, gross domestic product, which is used for healthcare. And the average cost per person is about $10,000 per person is allotted. Quite high. Care may be excellent, but the cost is quite high. And some people think even there the system is not that great. There are a lot of checks and balances, denials, insurance denials. The place is going through some turmoil. Whereas in Europe, the average cost is about 5,000 euros. Most of the countries take care of it. In China, it is about $600. And please guess what is it in India? Not even $80. Not even $80. And we spend 1.5-2% of our GDP for healthcare. But the surprising thing is, the government, the system says we should give equality to all, equal healthcare to all. And it is a combination of private and public. So now I am going to go into the details of where we stand with the Indian healthcare. What are the issues? And then in the end, I'll also discuss the possible solutions. Because it is very easy, as we know, to identify problems. There are a number of people in all aspects of life, we always identify problems. Easy identifying problems in our own household. Every day we say, this is a problem I have. This is a problem. Your children say they have the problems. And in work, we always have problems. We have this. And everybody has a problem. But very few solvers are there. And we don't even attempt to find solutions because we take pride in talking about problems. That is the negativity of our system also. But particularly when it comes to healthcare, whether we like or not, we have to find a solution. There has been various attempts to find solution, but none of it has been successful. So look at the scenario of India. India is like a continent, multiple countries within a country. You have affluent India, who have a good resource, good affluence. Their per capita income is high. By some standards, people living in certain affluent areas of Mumbai, Bangalore or Delhi have over $100,000 a year annual income, equal to our best of centers in the world. So that is a group which can afford healthcare, which can buy private insurance, or which can even pay. Why do I say they can pay? Because the cost in India is far lower compared to what it is in most of the advanced countries, particularly United States. So, for a person like me who has lived in the United States, where a cost of a MRI scan may be $2,000, cost of a PET scan may be $3,000. When I come to India, I see the cost of a PET scan is not even $300. Same PET scan. and well-qualified radiologists are reading it. And then you have an MRI which may cost $100, and you have a CT scan which sometimes may even $100 to $300 MRI. A CT scan may cost you $50 to $100. So when you have such low cost, the affluent people find it attractive to pay cash. And again, India also is a country where there is different kinds of cash. As we know, we have a system where there is what we call as underground economy. People generate cash which is not accounted for. So some of the business people who generate a lot of this cash, for them it is very easy to pay cash, which is not accounted. So there are various complexities in the system which makes it easy. And for a long time, people who are in affluent people have not complained about healthcare. A, it is cheap for them. B, lot of cash is flowing through, even though that is coming down because now there is some kind of transparency is coming, but still it is being used. So I will not talk much about the affluent. And one of the things I want to really mention here is nearly 77% of healthcare in India is provided by private. So it's important for the public and the government to understand this and see how we can work together to make healthcare a success. So leaving the affluent people aside, the focus is on the middle class and the lower socioeconomic group who are in a trap. Why do I call it a middle class trap? Because the middle class wants high care, they are well educated. Some of them have not taken insurance, or there are some limits in the insurance, but they want to make sure they go to the best of medical centers. But suppose, let us say the bill is 6 lakhs, 8 lakhs for certain procedure. They can only afford 4 lakhs or 5 lakhs. So they are in the trap where they can't meet this 1 lakh. So how do we meet the trap is another question. So let me explain to you the concept of the middle class trap. The middle class are the people who are fairly well educated, maybe working couple. They have good earning. When they are into this chronic disease, for example, maybe cancer, cardiac disease, or even simple things like kidney stone, the cost could be quite high. Hospitalization, they want to go to the best of centers, they want good care, they want to be in a private ward. Say the bill comes to 6-7 lakhs, they can afford only 3 or 4 lakhs. That is when they get into a trap where they may borrow money, they may also get a loan, and sometimes that gets into the problem to service the loan. I call it the middle class trap. Particularly in a disease which I am an expert on, cancer, it is an ongoing condition. Cancer is not a single day treatment. They may require treatment for months together. The cost can escalate. And for them, they want the best of care, but the cost keeps escalating. The insurance, they may not have insurance. Obviously, once you get a cancer, you will not get insurance. So this is a situation which is daunting and causing a lot of apprehension and headache to the middle class people and eroding their wealth. And sometimes we also hear stories of people selling their property, going broke because of the healthcare. I will come back and address solutions for these issues, but I just want to highlight that it can affect all of us. Now coming to the lower socioeconomic group, these are the people who may be below poverty line, who cannot really afford high-end care. So I want to take an example here of 4 individuals who come to a major hospital of different socioeconomic condition. An individual who is talking about upper strata who can afford. Suppose you say the cost is 10 lakhs, 15 lakhs. They pay the money, get supposedly the best of care, and they're gone. Now you have a second individual who comes because he has heard word of mouth, this is the best center. And obviously he has got an insurance. Through the insurance they pay, no issues. He has got some amount he has to pay, 1 or 2 lakhs, he covers it and very happy. The third individual is the one who comes and he can't afford. But he knows that is the best center. He goes to friends, families, borrows. Somehow he has got some money, makes it up. He's in the middle class, lower middle class, makes it up and gets the treatment. The issue is the lower socioeconomic group, the fourth individual who I mentioned, who has a spouse, let us say, with a disease like cancer, comes to a big institution, let us say like our institution, HCG, and you're told this is the cost. Yes, we can help you, but to some extent. But the patient says, no, I want the best of care here only. Then we suggest, look, there is a government institution close by. Why don't you go? He says, no, I want it in this institution. So this is the person which worries me the most, because he is the person who is likely to sell his property or borrow hand loans at 20, 30, 40% interest rate and probably dip into severe poverty because of health issues. He loves his spouse, he wants to do the right treatment, but he can go broke economically and it could have repercussions for the entire family. One has to understand these kind of situations. So these are the issues in general which are facing us. Now, has there been any solutions for people who are in this lower socioeconomic? How do you bring equality in healthcare? How is it possible a person who is driving a fancy car, living in a fancy house, getting a certain type of treatment, and a person who is living in a shackles, who is a rickshaw wala, his family or a poor farmer, can they also get the same treatment? Is it possible? And why certain schemes which have come are not meeting this kind of equality, I would like to discuss. Government, there are government hospitals. Of course, people can go and get literally maybe free treatment. First, why are they not going? Because, my friends, government is not able to meet the expectation of the people in terms of quality of care. It could be for reasons such as overcrowding. It could be for reasons like lack of funding, or it could be just the reason that they don't have right talent across the country. So taking this scenario, what I mentioned, there are issues with the schemes. Government, in all its thoughtfulness, trying to do good for society, came up with schemes called Ayushman schemes, healthcare schemes for the below poverty. Of course, people who are above poverty also used it. There is only certain pie. When they started using, the pie shrank. So that is another issue. The second issue is they put limitations. Take, for example, a disease like cancer. There is no way you can treat the cancer for a long period of time with a limited resource the government is paying them. For example, they may pay 5 lakhs. Absolutely not possible. So what happens? We don't measure the outcomes. So they go to a center, let us say, and they cut corners. They may not give the right treatment. Even when there is major operation, for example, esophagectomy, head and neck operation, major operations are required, we may not be able to do that, so they may cut corners to save costs. So what happens when the cancer comes back? There is no audit. The patient is told, the cancer, it has come back, what can I do? is expected to come back. So, a potentially curable disease has been undertreated and diseases come back because of lack of foresight into this issue of costing. That is why a lot of hospitals don't even participate in this scheme. And even the people who participate, some make sure they get the right treatment by raising funds otherwise or cross-subsidy, but some take this unethical approach of undertreating, since we don't measure the quality and outcome. A rickshawala's wife, is she getting the same outcome as somebody coming in a Mercedes-Benz? We are not measuring that. So the schemes are not measured. So we don't know the answer. But my own personal view is they are not getting the same outcome. Take for example a 28-year-old lady who comes to our clinic and says she has got a breast cancer. She is below poverty. So our doctor says, okay, you can take these treatments, targeted treatments, going to cost you, immunotherapy, going to cost you lakhs per month. The system says, no, I can pay only 5 lakhs total. So what do? We don't give them the right treatment. So what happens in that instance? The patients get undertreated. A year later, she comes with extensive disease all over the body. We look at the scan and say, doctor, why did this disease come back? Sir, I couldn't give the right treatment even though I am trained. I am trained to do the right treatment, but I couldn't deliver because the system did not allow. Whose fault it is? Who is the stakeholder who is at fault here? Is the doctor? Is the hospital? Or the scheme provider, the government? You please decide. You think and decide who is at fault. The answer is very simple. So, we have to be clear in the statement that there is a cost to low cost. So, everything cannot be low cost. So, these are the situations. Imagine a doctor facing. A doctor is well trained. He has to do 5 years of MBBS. Then he has to do postgraduate training in medicine, let us say, for 3 years. Then a DM in oncology for 3 years. So 11 years of training. He or she knows what is the right treatment for the patient. But damn it, I can't provide for the patient because the system is not allowing. When the patient comes back, I have sleepless night. What is it? Ethically, morally, have I done the right thing by not giving this treatment? Should I have told her to go somewhere? What should I have done? So this is the dilemma. This is the torture actually doctor with moral values go through, which public at large is not able to understand. Public only thinks, I went there, the scheme told this is the treatment. I thought I got the right treatment. Why my disease is coming back? They're not understanding they did not get the right treatment because the system did not pay for it. The system did not allow it. It's very easy to put a blame, and particularly for the government, which depends on popularity, for them to take the blame is very difficult. A lot of us as institutions, doctors, are not able to speak openly because we feel sometimes maybe that is not the right thing. Maybe we feel that, look, we should bring up these issues in right forums, right meetings. But unfortunately, the government doesn't involve the private enterprise in these decisions, which we have been talking about. In any decisions, when there is 77% healthcare is provided by private, the government should involve the private. They are not involving. The decisions are made by government hospitals, government doctors, government, think tanks, which absolutely do not understand what is going on at ground zero level. Even to the parliamentary committee, we mentioned these issues. They said about a year ago they'll take it up. So far, nothing has happened. So all I can say is this matter has to be in terms of a public backlash, public understanding, and demanding from these elected representatives, let there be a uniformity, redefine the role of government, redefine the role of private enterprise. So when I come to the answers for all these issues, there is only one answer, what I call as universal healthcare. Why do I use the term universal healthcare? Because equality in healthcare with no limits. This is what we should strive for, and the solution we are providing can make it happen. We require about $200 billion that can grow. It should be an autonomous body. How do we raise the funds? Extra tax on areas like smoking. By the way, I want to tell one point on smoking. If we ban smoking and chewing tobacco, 40% of the illness will go away. 40% of the cancers will go away. Head and neck cancer will decrease dramatically. Lung cancer will decrease dramatically. Heart diseases will decrease dramatically. But why is it? It is a proven. There is track record. But believe me, my friends, one parliamentarian asked me, Doctor, is there any definite evidence that smoking and chewing causes cancer? What can I say? It's a known fact. But you go to a movie, you see smoking is bad. The government shows a lot of signs. When you are paying for those ads, why can't you ban it? Why can't you ask farmers to develop alternate farming? We in HCG actually have done it. For 50 farmers, we gave them alternate farming. They're actually very happy. If you go to the tobacco growers and see, their hands, mouth are all burnt and their lungs are bad. So they suffer with chronic diseases, but still for the sake of money, they work in tobacco farm. When we did our best to wean them off of it, what did the tobacco companies do? Go and pay them more so that we can't compete with them and make sure they continue to do this business. So this is an area of great concern, an area doable. When we asked the government, I asked one of the health secretaries, wrote a letter to the finance minister, why can't we do this? The answer is very simple. Revenue, doctor, revenue. We get so much money, tax money from this, we can't let it go. So this is an area which is ill-conceived, ill-thought through, solvable has not been solved. But the solution I am providing, at least tax more, make it difficult for people to buy, and use the extra tax money from alcohol. We know alcohol also causes cancer, and smoking. Use the extra tax money to put it in this autonomous fund. Similarly, India is full of youths. And India, by some standard, 90% have cell phones, smartphones. So whatever their smartphone bill is, charge an excess on that, called health cess, and make sure it is recovered and put it into this endowment. By my calculation, using these means and based on the work taxing people according to the healthcare says, will provide us enough money initially to kickstart this universal healthcare. Once it is started, this universal healthcare can also double by just investing as a private equity, stock market, all of this private enterprise. They can invest and grow this money. Typical example is Canadian retirement fund, which has done extremely well by investing in the markets. Over the years, this 200 billion, every year 200 billion will be coming, and you will be spending part of it. It will also grow. It can even become $1 trillion. And we will be like an affluent country using this money for healthcare. Last but not least is what is the role of government. Government cannot be a monitoring body as well as a service provider. People go to government hospital, lack of respirator, lack of necessary staff, lack of certain medicines. People not only die, they develop into disabilities, difficult diseases, prolonged illness, but there is no audit. So in our view, government should not be in service. government should be a monitoring agency. Let us say, for example, a patient comes to our hospital, HCG. Hey, this patient has come, he's a rickshawala's wife. I want to make sure he gets the same treatment as Mercedes-Benz person's wife and same outcome. I will monitor you. I will pay you, I will monitor you. Done. So the government should ethically, in a transparent way, monitor and say whether people who are in lower socioeconomic group, who are born to this society, require equal rights and get the same treatment as affluent people. That should be the role of government. The government can also participate in training. There are various training institutions in India which have done well. Train doctors, train postgraduates, become a training center, become a center of excellence. But otherwise, let the private enterprise penetrate tier 2, tier 3 cities, provide the optimum care, and you monitor and make sure it is done because you are providing finances in this universal healthcare system. This provides the best of all. In my view, universal healthcare is the answer. It is doable. But why is it not done? Because common sense is so uncommon. As one of the great philosophers, Voltaire, said, we don't use common sense. And also, sometimes it is too simple. I call it simplicity in complexity or complexity in simplicity. So when things are simple, people want to make it very complex. It should be a complex solution. My friends, there is a simple solution. And India is a growing economy. Per capita income is growing. India is going to become, by some standard, maybe an advanced country. For us to do that, healthcare is a fundamental right of everyone. And healthcare is a right means equal right as everyone. Equal right as an affluent person, lower socioeconomic person also should get the same right. Let us all come together and work on it as doctors, hospital administrators, entrepreneurs, government bureaucrats, and government itself, finance department, revenue department, all of them have to come together, see this issue as a major issue for the country and solve it. And it is solvable. I hope we can achieve this goal. Thank you.